Hi, I'm Michael from Planet Naturopath. And this test is about the Cyrex Alzheimer's LYNX test. It's not necessarily a diagnostic tool, but it helps to understand, along with genetics, family history, whether you're at risk for Alzheimer's and how proactive you may need to be. Here is a list of all the antigens tested, including brain proteins, amyloid beta and proteins tau, which are associated with Alzheimer's but not necessarily the direct cause, as there are many factors involved. Plus, this test assesses for known environmental and food triggers for brain inflammation. This test is for people with normal brain health but maybe have a family history of Alzheimer's or the APOE gene, and they would come into this category. The preclinical stage, most people wouldn't know they have any problems. It could be just signs like forgetfulness, taking a long time to catch on to words, or even a loss of smell or hearing can be an early preclinical sign. Especially with family history or genes like the APOE4 gene, it may be worth getting tested in this stage because this is the stage where you can influence your outcomes with Alzheimer's and prevent Alzheimer's even occurring or delay the onset of Alzheimer's. With the mild cognitive impairment stage, this is the stage where symptoms are developing and you may not even have been diagnosed with Alzheimer's yet, but you're definitely getting forgetful, losing things, forgetting people's names, or taking a long time to catch on to people's names. This is still a good time to test in this early stage because there's something you can do about it. In the late stage of Alzheimer's, when you've already been diagnosed and there's a lot of signs and symptoms, it's probably too late to take this test. It's hard to reverse that situation, and it's like the example I use is upstream medicine and downstream medicine. And upstream medicine is all about lifestyle changes, prevention of things from happening. Downstream medicine is when it's too late, and that's where medical intervention is the only thing that may be helpful. Still, it doesn't hurt to try and focus on diet and nutrition, but it's probably not going to have as big an effect. So there's two main types of Alzheimer's. There's the early onset, which is very much relating to different genetics, and there's going to be a strong family history of that. And people can get it, quite early in life, often in the 40s, 50s, and 60s. But it's fairly rare, and doesn't occur as much as the late onset. This is the one that's influenced by many different things. The APOE4 can definitely increase your risk factor, that genetic, but many people have that gene and never get Alzheimer's. So there's a lot of diet and nutrition factors, sleep, chemicals, foods that can affect this. And this is where you can do a lot to slow down the progression or even prevent this disease from occurring. This is why these types of testing is important for these people. These are some of the brain proteins that are checked, and also things like BDNF, neurotrophins. Just having these is not going to be diagnostic, but it means you need to be more proactive and looking at other blood markers, things like homocysteine, even things like B12, other nutrients, gut health, are all going to be factors in insulin, making sure you're not pre-diabetic or diabetic. These are all factors that are going to increase your risk of Alzheimer's. There's a connection between oral pathogens and things like cardiovascular health. There's a strong connection, but there's also a connection between dental health or oral pathogens and brain health. Also, chemicals like mercury, aluminium can affect brain health. Understanding if there's any toxicity is important, and there's certain detoxification protocols you can take to help lower the risk of these chemicals affecting your brain. Foods can also cause inflammation, and some of the most common ones are egg, super nutritious food, but for some people it may not be the greatest. Seafoods, casein from dairy, gliadin is from wheat, and also other non-gluten wheat proteins can all trigger an inflammatory response that can affect brain health. And then understanding the blood-brain barrier, like if you've had a history of impact sports or a number of concussions or traumatic brain injury, you may have leaky blood-brain barrier, which can also affect your risk of dementia and Alzheimer's. So this test is for people with a history of Alzheimer's or are interested in prevention. If you have the APOE4 gene, either a single or a double copy. I have a single copy, so I'm always focused on my brain health and prevention of Alzheimer's. If you're showing signs of mild cognitive impairment, memory loss, or confusion. If you have a history of concussions or have played high-impact sports. If you have a history of diabetes or pre-diabetic, that can increase your risk of Alzheimer's, or chronic gut health problems. And it's probably not the best test for people who already have advanced Alzheimer's disease. So you can find out more about this test at planetnaturopath.com.